Hi everyone, welcome to week 10 of 4516, Nursing and Quality Practice, including continuing education and quality improvement initiatives. So this week we are discussing quality practice in nursing, particularly within Ontario. So we will look at quality from two different perspectives. Perspective one is quality nursing practice as an inherent part or an essential part of providing quality care to the public, which means that there has to be some way of determining if nurses are competent enough to meet the requirements for quality care. And number two, the nurses' roles in facilitating quality practice settings, including their involvement with quality improvement initiatives. So regardless of your area of practice, when you are an RN in Ontario, you are accountable to the CNO and you need to meet the CNO standards to demonstrate your competency in practice. CNO has a specific program to help you show that you are competent, and we will talk shortly about the Quality Assurance Program or the QA program. Now, I did touch on this in one of our online lectures a couple of weeks ago. Now, I want to first remind you about the importance of documentation. Documentation is not only used to track the care given to a patient, it can also be used as a way of supporting a claim that our nurse was not competent in practice. Nursing documentation is an important part of practice, and nurses' notes are a legal part of the patient's health record. Documentation must be clear, accurate, concise, non-judgmental, and done contemporaneously, meaning as soon as possible after an event, treatment, or situation, and definitely by the end of the shift. If something isn't documented, then it can be considered as not done. And so it is extremely important that you chart properly and regularly. It may seem like a pain to chart every shift and at the end of a long shift, but it's really important to protect yourselves in case you are ever sued. If you were to be sued, lawyers may take a big deal of the fact that you didn't chart contemporaneously. If there is enough of a delay, your charting could even not be allowed as evidence because it could be argued that it's less likely to be accurate. So you could end up with no evidence to support what you did, which leaves you more open to being found guilty of a legal charge as well as being vulnerable to charges of misconduct by CNO. Computerized documentation can really be your friend if you use it properly. The legibility of an electronic note system can help your lawyer if you're ever sued. On the other hand, illegible or incomplete notes can be used by a prosecuting lawyer to support a claim that you are not meeting expected standards. It is important that you always adhere to the CNO 2019 practice standard about documentation. So let's talk about CNO Quality Assurance. Unlike some professionals, nursing in Ontario doesn't have a requirement for the typical type of continuing education practice. So as an RN, you will not need to take a certain number of CE hours or continuing education hours, for example, workshops, to ensure you will be eligible to renew your registration. So as a physician in Ontario, you have to meet so many continuing education credits in order to be able to renew your registration. That doesn't happen for nurses. But that doesn't mean that you don't need to ensure you remain competent in practice. So as we discussed earlier in this course, the scope of nursing practice in Ontario is set by the provincial government. Part of the legislation gives CNO the power to ensure that all nurses registered in Ontario are competent. So the CNO has to be able to assure the public that nurses demonstrate their commitment to continuing competence and to continuing quality improvement. So maintaining registration in Ontario encompasses multiple aspects. As an RN, you must be and must remain what is called fit for practice. Note that a workplace setting is obliged to accommodate a nurse who becomes unable to perform their job. But there is a limit to that accommodation, and sometimes the nurse can legally be let go or fired. As we discussed in week 3, the necessary skills and abilities for a nurse in Ontario do not mean just being physically capable. Nurses who are aware that they don't have the necessary physical, mental, or emotional capacity to practice safely and competently must withdraw from providing care after consulting with their employer. This temporary withdrawal can become permanent depending on the situation. There are many standards or practice standards, etc., from CNO that you need to be familiar with because you must meet these requirements as an RN. We only have time to discuss a few of the documents in this course, and we will look at a few more next week, but it doesn't mean that the others are not important. These documents and requirements underlie the CNO Quality Assurance Program. At a bare minimum, RNs are expected to continue to meet the entry to practice requirements. These competencies are expected not only of RNs upon entry to practice, but also for ongoing registration with the CNO. They are used to guide the assessment of members' continuing competence for maintaining registration with the college. In a lawsuit, this document would be considered by a prosecutor along with other expectations of a nurse with similar education and in a similar context to show that a nurse was negligent by not meeting the expected standards of the profession. So let's talk about the Quality Assurance Program. So the purpose of the QA program is to assure the public that nurses demonstrate their commitment to continuing competence and continuing quality improvement. In some ways, it is kind of like the CNO version of continuing education. The Regulated Health Professions Act of 1991 requires the college to establish and administer a QA program that assists nurses in maintaining competence and continually evaluating their practice. So as I mentioned already, we don't have a requirement for taking courses, etc., to meet a certain number of hours to prove continuing competence. Instead, the college's QA program currently consists of 3 components: a self-assessment, a practice assessment, and a peer assessment. During the pandemic, CNO deferred the QA program until further notice. Members are expected to check back regularly for updates, and as at some point the program will resume. The usual process has been that every year at registration time in the fall, all RNs in Ontario are expected to reflect on their practice and develop a learning plan with 2 learning goals so that they can meet the self-assessment aspect of the program. Nurse practitioners have to do 3 learning goals. Presently, you keep your learning plan and goals and do not submit them to the CNO. But when you complete your membership renewal application online, you attest to having participated in the QA program. You need to keep the learning plan for 2 years in case CNO asks you to produce it. A new process is being put in place for 2023, though. As of then, a revised learning plan will be integrated with annual membership renewal, and a new multi-source feedback tool will also be used for QA purposes. Currently, a learning plan must only be submitted if your name is drawn randomly for practice assessment. The letter normally arrives in March or so, and it is a mandatory process. New registrants must still complete the self-assessment, but currently do not become eligible for selection for practice assessment until 2 years after first registering with CNO. Peer assessment is the 3rd part of the current QA program, and it involves nurses who work for CNO. I included links on Moodle or eClass to the 2019 guide about using the CNO QA application that is called MyQA. I also provided a link about how to develop a strong learning plan using SMART learning goals. You may find this SMART document very useful when you have to develop a learning plan for your integrated practicum. Note: I don't expect you to memorize all of the CNO documents. However, I do expect you to use them as resources and to understand about the role of CNO in how to maintain your registration as an RN in Ontario. You need to know the important pieces or steps. This type of information is basic to your understanding of the profession you have chosen as your career and the province in which you are getting your nursing education. In particular, you need to understand the CNO ethics document and the behavioral directives related to the ethical value of maintaining commitments. Now let's look at nursing and quality practice settings. The CNA links quality practice environments to ethics in practice. The Code of Ethics itself, and specifically within multiple CNA ethical responsibilities, gives nurses the ethical basis for advocating for quality practice environments that allow for the delivery of safe, compassionate, competent, and ethical care. The CNO also notes the importance of quality practice settings as part of many of its standards, including the ethics document. Both organizations state that nurses and employers are obliged to advocate for environments that have the needed organizational structures and resources to ensure safety, support, and respect for everyone in the practice setting, so including you as nurses. Note that quality practice settings also include processes related to confidentiality and privacy of a patient's health information, as well as the types of communication and technological systems we discussed last week. Healthy work environments have certain characteristics. Number one, the culture is collaborative, which means that people work together in harmony. Number two, staff are skilled communicators, which helps ensures clear and open communication and also contributes to reduce conflict in the workplace. Number three, there are clear processes that facilitate effective decision-making, and the people who should be involved in decision-making about a particular issue are involved, not excluded. Number four, sufficient staff are allocated for the work that needs to be done, and the staff mix is appropriate to maximize outcomes. Number five, staff feel that they not only are acknowledged for their work, but that the recognition is done in a way that is meaningful to them. And number six, without effective leadership, then work environments are unlikely to be perceived by staff as healthy places to work. The indicators of a healthy work environment show positive outcomes for staff, patients, and the organization as a whole. For example, nurses are happy in their work and they feel that their health and well-being are being maximized within their workplace. Patients receive high-quality care, and measures of outcomes such as patient satisfaction show that patients feel positive about the quality of care they received. The organization itself is well-run, its core values are enacted throughout the setting, and indicators such as accreditation approval show a strong performance overall. Quality improvement, or QI, is a continuous process that involves all levels of an organization working together across units and departments. So it is not a one-time project. QI aims to produce better services for everyone in the organization. Measurement is important in QI. Otherwise, how would you know if the changes you are making are leading to improvement? Measurement in QI is what allows a QI team to first demonstrate the setting's current performance or baseline. Number two, set goals for future performance. And three, monitor the effects of changes as they are made. Language that is commonly used about measurement includes indicators, performance measures, or just measures. Choosing the right measures is critical, as successful measurement is a cornerstone of successful improvement. Picking the right measures lets the QI team quickly see results, which means that they can then adapt their interventions, thus putting less strain on resources and more focus on outcomes. So QI is used to bring new knowledge into daily practice. Just enough data are gathered to learn and complete another QI cycle. Using an approach in which small tests are made of significant changes helps speed up the rate of improvement. Each QI team needs to develop a measurement plan that includes what will be measured, how often it will be measured, who will do the measurement, and how the measurements will be shared across the team. The plan needs to be regularly reviewed with the team during the process to ensure it's working and that everyone is clear about the goals. Of course, the analysis needs to be shared with staff and other stakeholders to keep their buy-in. Typically, multiple categories of measures are used together to try to ensure an accurate picture of the effects of the QI changes that are being done. These 4 types of measures could all be in a single QI cycle. They are 1. Outcome measures capture setting performance, so they are the voice of the patient in healthcare settings. Process measures capture changes to the inputs or steps that contribute to the system outcomes. Balancing measures examine whether or not changes to one part of the system cause new problems in another part of the system. And number 4, the PDSA stands for Plan, Do, Study, and Act. And PDSA measures provide information about the effect of each change attempt, so they are collected with each test of change that is done. For today's class, you were to review parts of Ryerson University's online resource for quality improvement called QI Methods and Tools for Nurses. I hope you enjoyed working through the self-assessment tests in both Module 1 and Module 3. It is often interesting to see where you thought you had knowledge, but in fact you do not. You are welcome to review all parts of this resource if and when you have time, and it will be especially useful for you when you become an RN. We are going to focus on the model for improvement using PDSA cycles. Within the model for improvement, quality improvement is a process that begins with 3 key questions. Number 1, the aim. What are we trying to accomplish? Number 2, the measure. How will we know that a change is an improvement? And number 3, change. Which change can we make that will result in improvement? These 3 questions are to help you focus on where and how the change needs to take place over time. They reinforce the ongoing nature of QI. Problem and opportunity statements are used to 1. Describe the current state, 2. Show that there is a need to act, and 3. Help develop a goal that will really address the problem. The aim statement arises from the problem opportunity statements. It has to be specific and measurable, so you need to clearly identify the measures to be used, the time frame by which a goal should be met, and the population that will be affected. The aim statement must therefore meet the SMART standard: specific, measurable, attainable, actionable, relevant and realistic, and time-bound. When thinking about what types of change might need to take place, it is often helpful to consider the 4 broad change concepts: reduce waste, promote efficiency, improve reliability, and improve access. Brainstorming with your QI team should lead to specific change concepts within any or all of the broad concepts, and your change ideas will then flow from the specific change concepts. Because QI focuses on continuously improving, then changes should normally be implemented on a small scale, at least at first. The PDSA cycle is used to plan a small-scale change and to identify unintended outcomes. So remember, PDSA is plan. So plan is the who, what, where, when, and why of the approach. Do is when the test is conducted and data measurements, challenges, and unintended consequences are documented. Study is about analyzing the data and studying the results, then comparing the data with your prediction before summarizing and reflecting on what you've learned. And act is about refining the change idea based on lessons learned in the test and preparing a plan for the next test. Depending on the results in this cycle, an idea could be adopted, adapted, or abandoned. The PDSA ramp is a way of using planned multiple cycles to test and adapt change. The QI team can then be innovative and also test feasibility as it goes. Data collection at each step will show quickly if the change is an improvement or not, and small tests of change tend to be lower risk or tend to be a lower risk way because people are often hesitant about change at first. So a small change at a time may be more palatable. A PDSA ramp can be used for refining a change or breaking down a part of the change, and PDSA ramps can be used consecutively or simultaneously. So we will discuss more of nursing and quality practice in week 10 Zoom meeting, which is on Tuesday, November the 24th from 3 to 4 p.m. See you then.